The title of my project is Retrospective Analysis of Disease Severity Stratification in Esophageal Atresia at a Single Institution. My name is Evanovich. I'm a Master's of Science candidate at Tufts University, and I'm currently part of the PCARI program at Boston Children's Hospital under the mentorship of Dr. Esophageal, who is the principal investigator for this study. We conducted a retrospective analysis of term-born and preterm infants that underwent primary surgical repair of esophageal atresia at our institution. Esophageal atresia is classified by anatomical description into 4 types, as you can see to the left here with the incidence in the literature displayed below. Our retrospective analysis from 2009 to 2020 of initial repair at the Esophageal and Airway Treatment Center aligns with previous esophageal atresia incidence per anatomical types, as seen in the pie chart to the left here. Since anatomical types of esophageal atresia have no indication of disease severity, we addressed the complexity of critical illness in the context of disease severity and survival scores. Our novel findings show almost equal distribution of esophageal atresia patients based on sex and gestational age. This is seen most clearly in the most common type of esophageal atresia, type C, with panel A showing sex, and panel B showing gestational age, separated in our cohort as term-born and preterm patients. Of the subset of patients that required the Fokker process for long gap esophageal atresia, there is an exactly equal distribution of patients by sex, shown in panel C, and gestational age, shown in panel D. Premature infants with esophageal atresia are sicker per ASA, but not PRAM scoring in the most common esophageal atresia type, type C. As seen in panel A, all patients were scored as ASA 3 or 4. In the most common type of esophageal atresia, type C, there were more ASA 4 patients in the preterm group. In panel B, we see wide PRAM score variability by gestational age and by esophageal atresia type. We show improvement in survival rates of our cohort over the last decade according to Spitz classification. The Spitz classification stratifies patients according to birth weight and presence of a major cardiac anomaly defined as requiring medical or surgical intervention. Group 1 indicates low risk, 2 medium risk, and 3 high risk. Group 1, the low risk group, in 1994 showed high survival rates, a small increase in the following decade, and we report 100% survival in this cohort. Group 2, medium risk, showed moderate survival rates in 1994, a large increase in the following decade, and we report a 90% survival rate in this cohort. In fact, this is the only cohort that we showed any mortality in. And finally, group 3, the highest risk, showed low survival rates in 1994, a large increase in the following decade, and we report 100% survival in this cohort. However, we only had 1 patient that met criteria for this group. Our study is a foundation for future clinical study designs of outcomes in a selected group of critically ill infants born with esophageal atresia. Thank you very much for your attention, and I'll take questions now.